Yes.
Good morning to all. My topic is correlation between the initial OCT parameters and the gain in BCVA after intravitreal ranibizumab in patients with macular edema secondary to BRVO. Retinal vein occlusion is the second most common retinal vascular disease to cause visual loss in adults after diabetic retinopathy, and these are classified mainly into two types: central retinal vein occlusion and branch retinal vein occlusion, the latter being more prevalent. So ischemia can result in secretion of vascular endothelial growth factor. This can cause vascular leakage and retinal edema. Therefore, VEGF has a leading role in retinal vein occlusion pathogenesis and symptoms. As a consequence, use of anti-VEGF agents by intravitreal injection has become very common to improve the clinical outcome in this patient by reducing the macular edema. With the advent of spectral domain OCT, the different retinal inner and outer layers can be studied easily, and there are 3 to 4 distinct hyperreflective bands on SD-OCT. This can be identified by OCT scan report, and the first band is the innermost, that is the of the least indents of the 4 hyperreflective bands, that is the ELM, external limiting membrane. The second band, which is now referred to as the ellipsoid zone, is the intersegment outer segment junction. The third band is referred to as the interdigitation zone. Fourth band is the RP, Brooks membrane complex. So we can grade the ellipsoid zone band as normal or abnormal, and abnormal ellipsoid zone can be either of abnormal reflectivity but continuous, discontinuous or disrupted or absent ellipsoid zone. So objective of my study is to find the correlation between ellipsoid zone integrity, ELM integrity in the pre-treatment OCT, and the gain in best corrected visual acuity at 1 month and 3 months post intravitreal ranibizumab in BRVO patients with macular edema. Materials and method. The study design, it's a hospital-based prospective observational study. Study setting is a tertiary eye care center in Kerala. And study population, patients who are diagnosed with macular edema secondary to BRVO and who are going to be treated with intravitreal injection ranibizumab in a tertiary eye care center in Kerala. The data collection tools were the BCVA in logMAR chart, an indirect ophthalmoscope and slit-line biomicroscope with 90D, and Heidelberg OCT scan reports were analyzed. My inclusion criteria were age above 18 and who gave consent for the study, and patients who are going to be treated with intravitreal injection ranibizumab with macular edema equal or more than 300 micrometer on OCT scan. And exclusion criteria were patients who have not taken any OCT for follow-up, and patients with media opacities which can affect the vision, and patients of OCT scan with low image quality, and patients with other retinal pathologies which can also affect the final visual acuity like diabetic macular edema, ARMD. And rationale of my studies, there have been many studies which has correlated the visual acuity and OCT parameters at the same time after taking the intravitreal injection, but only a few studies have compared the OCT parameters before taking injection and the gain in visual acuity after injection. And recent studies have shown there is a significant correlation between the pre-treatment OCT parameters. And my sample size was 38, and consecutive sampling is done. And methodology, study subjects after obtaining consent, the study variables were assessed, and the best corrected visual acuity and SD-OCT scan before intravitreal anti-VEGF were assessed, and BCVA after 1 month and after 3 months of injection, intravitreal injection were assessed. The gain in BCVA at 1 month and 3rd month post intravitreal anti-VEGF were assessed, and analysis was done. And the results were, in my study subjects, 37% of the patients, they were having a disrupted ellipsoid zone, and 63 patients had an intact ellipsoid zone. And ELM, 82% had an intact ELM, and 18%, that is 7, had a disrupted ELM. And the mean gain in best corrected visual acuity for intact ellipsoid zone group was 0.34 at the end of 1st month post injection, and the further gain in BCVA at the end of 3rd month was 0.1 with a significant p-value. And those with disrupted ellipsoid zone, the gain in BCVA at the end of 1st month was 0.08, and the further gain at 3rd month was 0. And the mean gain in best corrected visual acuity in intact ELM group was 0.29 at 1st month, and the further gain at 3rd month was 0.07 with a significant p-value, and those with disrupted ELM, the gain in BCVA at first month post injection was 0.03, and the further gain in BCVA at 3 months post injection was 0. So I came to the conclusion that out of the 38 patients studied, 24 who had ellipsoid zone integrity in the initial pre-treatment OCT, they had a better visual outcome than the remaining 14 who had a loss of ellipsoid zone integrity. And ELM integrity was also associated with a better visual outcome after intravitreal injection. Coming to discussion, in the retrospective study by Heyman Kang et al. In 2012, the mean BCVA improved significantly in the intact ISOS junction group, and it was not statistically significant in the disrupted photoreceptor group. And the mean BCVA improved significantly in the intact ELM group. However, there was no significant improvement in disrupted ELM group. And in the study by Errol W. Chan et al. In 2019, worsening of visual acuity of 1 year was associated with increase in disorganization of retinal inner layers and ellipsoid zone disruption, and early recovery of drill and ellipsoid zone improves the visual acuity outcome. And limitations of my study was a limited sample size, and other factors like the initial central macular thickness and disorganization of retinal inner layers can also affect the final visual outcome post intravitreal anti-VEGF injection. And these are my references. Thank you.
Actually, you have exceeded the time actually, more than 5 minutes. Or 6 minutes, sorry. Okay. How did I calculate the sample size? Who has calculated for you?
A statistician has helped me to calculate, sir.
Acha.
How many intravitreal were given in 3 months?
Only one, sir. And I studied the best corrected visual acuity after 1 month and 3rd month post injection.
Will the effect of one injection last for 3 months?
There was no deterioration found in the visual acuity in the 38 patients, sir. But I could get a maximum gain in the first month.
You included only branch vein occlusion?
Yes, sir.
Diabetic retinopathy was
Excluded from the study.
Purely
BRVO patients were studied.
Which branch?
Excluded all diabetic patient in it?
Mild NPDR was included, sir, but only 2 patients, and I excluded other diabetic retinopathy and ARMT.
Which branch, ma'am?
STBRVO, ITBRVO was there, sir.
Pardon?
Sir,
IT?
infratemporal and supratemporal BRVO was studied with macular edema.
Okay.
Do you know to give an intravitreal injection?
Sir?
Do you know how to give an intravitreal injection?
Yes, sir.
Have you given?
Yes, sir.
Yes.
You have assessed the visual acuity in terms of which chart?
Which?
Chart.
Logma unit, sir. Logma chart, sir.
Glaucoma charts.
Sir, I assessed using Snellen's and then I converted to the Logma units.
So you have calculated and then
Converted to Logma units.
You have got a Logmar unit in your hospital, the chart?
It is there, sir, but I assessed in Snellen's, then converted to Logma.
How?
It was by a conversion table.
Is there, huh?
Yes, sir.
Where?
In my hospital, in the ward, it is there.
Is there?
Yes.
You got to take a photograph? No.
It is not in this presentation I have.
Okay, no. Okay.
Which is a better chart, Snellen's chart or Logmar?
Logma chart.